Over the last 6 months, CBS News Detroit has been putting a spotlight on youth mental health in the state. That crisis here, also in Michigan, experiencing that issue throughout the state. So we've talked to families, advocates, mental health professionals, and school leaders, but now we're taking it a step further.
Tomorrow, Michigan State is going to make an announcement, a big announcement, about a study happening all across the state of Michigan, focusing on youth mental health intervention before things happen. Well, we thought the study leaders should meet some very important people.
Remember this story? 3 mothers, Laura, Michelle, and Rachel, all who have experienced mental health crises with their children. Well, they teamed up, formed a Facebook group, and now are helping hundreds of other families across the state find information and resources for their children in crisis. Then, this came across my desk. An announcement from Michigan State's Department of Psychiatry called Safe and Sound Schools. With funding through the Michigan Department of Education, MSU is planning a 5-year study pairing mental health mentors and advocates with children in crisis. The goal? To stop school shootings before they happen by intervening in a child's mental health early. So, we thought the two groups should meet.
Safe and Sound Schools was created by Michelle Gay. Unfortunately, she lost her daughter, Josephine and Sandy Hook. She actually had another daughter in the school at the time, and that daughter survived. So when we got the appropriation from the state, I had the opportunity to join Safe and Sound Schools as the Senior Director for Violence Prevention, and Elise and I are the co-directors of this project. But I think one of the things that sadly we found through our analysis of the ASV data is that so many of these individuals, whether they completed an attack or the attack was averted, got lost in the cracks. There was not one system per se that wrapped their arms around these kids and their families. And I always say and their families because you know this. We can do everything we can for the child, but if we're not helping the caregivers, then we're fighting a losing battle.
He was throwing chairs and taking his shoes off and throwing his shoes at the other kids.
There's no help. And at the time my son was in Utah, we were private paying because our insurance didn't cover it. I always have to make sure I get that in there. Insurance did not cover it.
All I want for him, because at this point, at 14, almost 15 years old, he doesn't even have not one secure attachment in his life. Someone that he can feel loved and communicate with and feel safe and secure. I can't tell you how putting that into words breaks my heart.
You're talking about our families, right? Our families, the families that we work with and we're connected to. You're talking about us. I've never felt so identified. And we have almost 600 of them in our group. They are fighting tirelessly for resources for their children. These are some of the bravest, strongest parents I know that should not have to be advocating the way they're advocating. It's very validating to have all of you say, parents need support. It's not because you're bad parents, it's because it takes a whole team approach to navigate these really complex needs. It's validating.
Coming from law enforcement, one of the things I learned is we tell people too much how we're going to save them, but we don't really listen to them. So I think a very important piece of this is listening to you all, because you have your story, you have your lived experience, and we have to keep listening to that in order to be good at what we're hoping to do.
These kids need to be assessed in a way that develops a plan that truly is an intensive care plan. A plan that is devised by a panel of people who understand mental health.
I feel hopeful about the project that you're working on, and I'm really looking forward to seeing it in action.
It's been extremely helpful.
Good.
And now, as a result, our team of moms and CBS Detroit are being given a ringside seat for the next 5 years as special guests of the psychiatry department, as we all search for solutions for a state in crisis.
Well, tomorrow, MSU is hosting their announcement and press conference about the Safe and Sound School initiative. But after the keynote address from the mother of a child killed in the Sandy Hook shooting and founder of the initiative, all media will be asked to leave so that crisis training and discussion can begin, except for CBS Detroit and our team of moms. And we're going to stay involved for the next 5 years and beyond as we continue to search for solutions with our youth mental health crisis.